In the midst of COVID-19 pandemic, remote healthcare is an idea whose time has come. I came up with the idea for Punya in 2018 because I wanted to remotely monitor my mother's health and well-being. Punya brings hospital-level monitoring and connected care to your smartphone. Our solution uses an FDA-approved intelligent health algorithm combined with IoT technology and Punya's proprietary apps. This empowers patient, family members and carers to proactively monitor their health and well-being. Even if you're miles away from your loved ones, Punya will always be there.
Punya's technology can be used to collect a wide range of medical data. Used alongside our assessment questions, it forms part of an early warning score that doctors can use for diagnosis and treatment.
Well, the great thing about Punya is that it saves doctors time, it saves patients and the healthcare service money, and allows us to pick up problems before they become severe.
Punya's clinical dashboard reveals real-time deteriorations in patients' health. Our algorithm can detect early warning signs and let doctors know when things go wrong.
So the first thing that we do when a patient comes to the practice is we take their vital signs. And the fact that they arrive with months' worth of data for us to analyze is significant. This data is incredibly valuable because it allows us to spot trends, such as deterioration in patient conditions and hopefully improvement.
By communicating health information in real time, Punya benefits carers, relatives and patients alike.
So remote healthcare market is just at the beginning of a very long-term growth trend. As we have seen with COVID-19 situation, and as it was already apparent to entrepreneurs like Deepthi, every single human being out there would benefit from remote monitoring of their health.
Healthcare systems all around the world are struggling to cope with both limited resources and the rise of an elderly population. The UK currently spends around 10% of its GDP on healthcare, and around 55% of that budget is spent on the over 85s. It's not surprising that the remote monitoring market is expected to grow by nearly 50% a year and to exceed $30 billion by the end of 2023.
Healthcare industry has been ripe for disruption for a long time. What COVID-19 situation has done is it has just accelerated that timeline significantly.
Well, I think it's clear that remote patient monitoring is definitely a part of the future of medicine, and Punya's technology facilitates that.
This is a tremendous opportunity to join in at the start of a rapidly growing market.
As well as monitoring various conditions, Punya allows patients to self-isolate and monitor their early warning symptoms and signs. Thanks to Punya's technology, all this takes place without exposing care workers to the virus.
Over the past 2 years, Punya has won numerous awards, including Best Startup at the Innovation Showcase at Healthcare Unblocked, finalist in the Tech Leaders Awards, and one of the top 100 Asian tech stars in 2019.
We're working with UCL London on a contact tracing project. We will be remotely monitoring positively tested people during the self-isolation. We're also looking forward to start our pilot with Homerton Hospital. Punya started with the goal of helping me take care of my elderly mother in India. At that time, nobody had foreseen the impact of COVID-19 on society. But what is clear is that demand for remote healthcare is exploding. With your help, we can continue our mission and make the world a safer, happier, and a healthier place.